And now I want to show you how to release the Splenius Capitis. So I'm going to show you how to do this just with your hands because it's so easy to do. You're going to take your left hand and find the spine right in the center of your neck. Now you want to keep your head looking up a little bit, not hanging down, because hanging down it's going to pull all these muscles taut and it will be difficult for you to palpate them and feel them. So lift your chin, find the center of your spine. You can feel those bony nubs back there. And then just walk your fingers off to the right a little bit and you can feel there's some ropes right in there. And I'm just kind of right around the center of the back of the neck. And I feel into those ropes. Oh yeah, that's great. Make a little claw with that left hand. Go into that ropiness and you'll feel they'll kind of wiggle around. You want to stay in that rope. And then you want to take your right hand and you're going to use the right hand for the pressure. So you push with your right hand into those ropes. Notice I started to roll off. I want to kind of get into those ropes, push in, and then turn your head side to side. If when you turn your head side to side, it changes it and feels a little more tender and then a little less tender, then you know you're in the right spot. You're going to push those fingers in, turn your head a little side to side. Ooh, so good. Remember, you want to also release sternocleidomastoid. So helpful. Turning, 5, 4, 3, 2, 1. Great. And then I like to take my right hand and just rub that mastoid process, just along those attachments at the base of the skull a little bit. Just rub. A couple deep breaths in your belly. Now, check it out, turning your head right and left. Oh yeah, I feel so much freer turning this way. Now turning that way, oh, I feel it right here. So you could do the other side. You could take your right hand to the spine, move off to the side. Watch your microphone wire there. You're going to find those ropes. You're going to lift the chin a little, press in, and then you're going to take your left hand right on those fingertips, push in. Oh, it feels so good. You could just hang out there. You could just be like, oh my gosh, that's a spot, right? And then turning the head a little side to side. Oh, it feels so good, sort of, in a trigger pointing kind of way. 5, 4, 3, it's feeling freer, 2, and 1. Then take your left hand right behind that mastoid process there, right behind the ear, rub, rub, rub. Rub a little bit on the base of the skull. So good. Now turning your head, so much freer, so much better. I'm not feeling that pull quite as much in that mastoid process. So something to know about the Splenius Capitis and sternocleidomastoid in their relationship. They both attach at that mastoid process. The right side right side Splenius Capitis turns your head to the right. The left sternocleidomastoid turns your head to the right. So they're kind of diagonal friends. Left sternocleidomastoid, right Splenius Capitis do the same movement. Left Splenius Capitis, right sternocleidomastoid, turn your head to the left. So you want to make sure you work opposite sides. I just do both. I do both SCMs, both Splenius Capitises or Splenius Capiti, maybe, and just to clear that whole system. Just to understand that the left sternocleidomastoid, the right Splenius Capitis, they do the same job. So I hope and trust that you found this video to be helpful. I know it's going to help your headache situation really improve, and I look forward to seeing you in the next video.